Good afternoon, everyone. Can everyone hear me all the way in the back? Excellent. I didn't expect such a huge room. However, thank you all for being here today. I'm sure this is lunchtime for most, and your presence here is really much appreciated. So what I would like to do first is understand who everyone is out here. So how many of you are OCD sufferers? Okay, that's quite an amount. And how many of you are family members? Okay. And how many of you are treatment professionals? Okay, that's a good amount too. And how many of you are just here hanging out in Austin? Okay, well, the reason why we came up with this talk is because after both Harold and Sam went through RFC's intensive outpatient program and they were doing well, they consistently had a fear of relapsing. And their OCD then morphed into a fear of having OCD, and then their compulsions revolved around whatever they can do to prevent relapsing. So how many of you have gone through treatment? And how many of you fear relapsing? Okay. So what we're going to learn today is how to let that fear go, okay? Because having that fear is actually going to keep you stuck in OCD world. So what I'm going to do is I'm going to go through some psychoeducation just to remind those of you who's gone through treatment what it is that you're doing that's keeping you stuck and what you need to do to break free from that vicious OCD cycle. Then I'm going to turn the table out around to both Sam and Harold to talk about their experiences and how they were able to and continue to be able to get past the fear of relapsing. All right? So, for those of you who are just here in Austin hanging out, I want you to also understand what it's like to have OCD, all right? So what I want you to do is I want you all to close your eyes, and I want you to imagine a loved one. Okay, I want you to get that picture in your head, whoever that is, whether it's a child, a spouse, a family member, a friend. And now I want you to imagine that you're supposed to be meeting them at 3 p.m. And it's 3 p.m. and you're waiting for them and they're not at your door. From 0 to 10 of discomfort, how uncomfortable would you be at this time? You can all open your eyes. How many of you would be at a 10 right now already? None of you. Right? You're probably like, it's just 3 o'clock, no big deal, especially if you live in LA and it's, you're in LA traffic. However, what if right now it's 3:15? How many of you would feel uncomfortable? A little bit? Yeah, from 0 to 10, would you be like at a 5 maybe? Okay. So let's move ahead, and now let's say it is 4 p.m. and the person is now an hour late. 0 to 10, where would you be in your discomfort level? 10? I think it would depend who it is, right? I mean, if it's a child, I'd be at a 20. If it is a partner or spouse who's always late, maybe not even a 2, right? Depends. So now let's forward it some more, and it's 6 p.m. The person still hasn't shown. Where would your discomfort level be? Pretty close to a 10, right? What would you be doing at this point? Would you be able to just sit there and watch TV, read a book, listen to a lecture? Or would you be pacing around, trying to call them, hacking into their emails, Facebook. Now let's say it's midnight and the person still hasn't shown. What would you be doing right now? At midnight is what a person with OCD experiences all the time. So this is basically what we just went through. You have thoughts, right? What would you be thinking about? Would you just be thinking about Disneyland? Spending time at the beach? Or would you be having horrific thoughts entering your mind? Possibly all sorts of crazy, disturbing, forbidden thoughts of what might have happened to this person. And naturally so, if you're going to have horrible thoughts, you're going to feel uncomfortable about it, right? And we live in a society that doesn't like to experience discomfort, which is why it's a multi-billion-dollar pharmaceutical industry. So we engage in compulsions. Every time you go and pick up the phone to try to call, that's a compulsion. And as you're picking up the phone, you get a sense of slight relief, of hope. And then as soon as there's no answer, you hang up the phone, what happens? The thoughts come back, and you're feeling fear again. So what do next? You go and try the next thing to gain relief, the next thing to gain relief. And each time you engage in a behavior to gain some sort of relief, you become disappointed when you don't get the long-term relief, because the thoughts will always come back. So this vicious cycle is basically what a person with OCD experiences. I want to give you a different metaphor for those of you who still isn't able to conceptualize this. So to understand this, let's imagine that your headache is the obsession. You have a headache. You don't like headaches. If I have a headache, it might mean I have a brain tumor. So I'm going to avoid headaches at all costs. Now, headaches are very common. We all experience headaches, right? But not for the person who has a fear of contracting brain tumor. So let's say you have a headache. And whenever you have a headache, you're going to feel uncomfortable. And what is it that most people do when they have headaches? Take an Advil, okay? So you take an Advil, that's the compulsion. And every time you get you take the Advil, I feel better. But does that mean the headache's over? You will never ever get a headache again. No, you'll get another headache because that's just what happens. Your body does what it does, and headaches come and go. So the next time you get a headache, you're feeling uncomfortable again. However, let's say this time you look into your medicine cabinet and there's no Advil. However, you have the choice of taking Tylenol. So you take a Tylenol, and Tylenol does not give you the relief that you're used to. So you're suffering through your headache. Will that headache eventually go away on its own? Usually. Does that mean it's over for good? No, headaches will come back. So the next time when you get a headache again, let's say this time you've replenished your medicine cabinet with Advil. Now you have a choice, Advil, Tylenol. Which would you choose? Advil. Don't everyone speak all at one time. You're going to hurt my ears. Advil, right? And you're going to take Advil. Why? Because it worked. Now, if we're to look at this cycle, the problem here is what works to give you that slight relief. So what we want to do is not get the relief, which sounds a little bit insane, doesn't it? However, if you want to break free from OCD, then that's what you have to strive for. Tolerate the discomfort, because it will go away on its own. So what I want to introduce you guys to is this functional triangle. This is our basic level of life. You have your thoughts, you have your behaviors, you have your emotions. Now let's start with emotions. How many of you believe that you or anyone in this world has complete control over your emotions? So if I snap my fingers and I say, I want you all to experience joy right now, you can just do that. Or if I say, now I want you to experience anger, you can all do that. You can't. Because in order to experience an emotion, you have to have a thought or a thought of an experience that can place you back to that emotional place. Okay? So thoughts we do not have direct access to because they're triggered from, emotions we do not have direct access to because they're triggered from thoughts. Okay? What about thoughts? Do any of you think that you have direct control over your thoughts? Well, here's the classic example. I want all of you to not think of the yellow duck. Don't think of the yellow duck, don't think of the yellow duck, don't think of the yellow duck. And some of you are smiling right now. Why is that? Duck, that damn duck won't get out of my head. Now don't think of the yellow duck in the blue pond. What are you doing? The reason why this happens is because at any given second, you have billions of tiny stimuli that enters and exits your mind. And you have no control over what enters and exits your mind because of the 5 senses that you have. From the time that you are in utero, these 5 senses are turned on until the day you die. These 5 senses are even on when you're asleep, which is why you experience sensations, which is why you experience dreams in your sleep. So because these 5 senses are on, you can never turn them off. What you do have control over is called selective attention. You choose what of these stimuli you want to pay attention to. So which is why when I say don't think of the yellow duck, I've focused your attention onto the yellow duck. This is why diets don't work. If you think about it, when we're on a diet, we're constantly telling ourselves what we're not supposed to eat. Well, right now, just thinking about that, I'm not supposed to eat chocolate. I want some chocolate. Anyone got chocolate? So, you do not have direct control over your thoughts. What you do have control over are your behaviors, which includes your actions and your reactions to your thoughts. So if I say, stick your right arm out, can you do it? Yes, you can. Thank you for sticking that right arm out. Okay? And if I say, don't wash your hands, can you do it? Yes, you can. You may not want to. It may not feel good. However, you can. If I say, don't check doorknobs, don't check the stove, can you do that? Yes, you can. It may not feel good. You may not want to. However, the important point here is that you can. Okay? Now let's talk about the fight-or-flight response. I'm sure you've heard this over and over and over again, and maybe some of your therapist has pounded into your head so much that you don't even want to think about the fight-or-flight response. However, this is important, and I'm going to explain to you why. Because if you understand the fight or flight response, then you can dissociate the fight or flight response to OCD. Okay? Because the fight or flight response is very, very important and necessary to your survival. So, imagine back in the caveman days, you walk out of your cave, and right in front of you is a saber-tooth. You have 2 options to survive this saber-tooth. And if you imagine your body is a very well-made machine equipped for survival, you better use one of these 2 options. What are the 2 options that you have? Again, don't everybody jump at one time. fight, or flight, right? Now, there is a third response. It's called the freeze response, except if you froze at this moment, you probably become lunch. You wouldn't be very adaptable, according to Darwin. So you can either fight or you can run. Certain mechanisms in your body prepare you to be mobile, prepare you to fight or run. So your heart starts palpitating, and your heart starts palpitating because your heart is your body's motor. The purpose of the heart is to pump blood throughout your system, okay? Why is it pumping blood throughout your system? Does anybody know? Exactly. You're transferring oxygen throughout your body, which is why you're breathing heavily. You're breathing heavily in order to bring in oxygen into your lungs so that your heart can pump that blood carrying the oxygen throughout your organs, especially to your brain, which you're going to need at this point, and your large muscle groups. Okay? So if you've ever had a limb that's fallen asleep, why do you think that happens? Because you didn't get enough oxygen into that body part. Now, if you were in a true saber-tooth alarm, again, you'd be lunch, okay? So your GI tract, your gastrointestinal tract, shuts down during a fight or flight trigger. And it shuts down because your energy has to be diverted to your large muscle groups rather than your core. Okay, so for some of you who have digestive issues, who have headaches, body aches, this is the reason why. Because there's not enough energy being focused in your core. Okay? One quick fact. Your ability for reasoning, rational thinking, do you think it goes up or goes down during a fight or flight alarm? Goes down, exactly. Some people don't know this. Because if you were in a true alarm situation, you have no time or mental space to deliberate, should I run this way or that way to survive? Will this weapon be better or that weapon be better to fight? You have to just react and respond. So if you have a family member, or if you are a family member, who tells the sufferer, oh, just think about it, during an anxious moment, well, it's kind of a little bit challenging to think about it in the moment, okay? Which is why we practice the work before that moment, right, guys?
Right.
Okay. So this is what happens, right? However, what if you walk out of your cave and instead you see this? Would your fight or flight alarm be triggered? No. Again, you'd be lunch though. Except the important point here is that who is the one to trigger that fight or flight alarm? You are. You have to perceive danger in order to send that message to your brain. Alarm, 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 alarm. Danger, 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 danger. And then your body simply reacts. Your body does not know the difference whether this is a true alarm or a false alarm. It simply reacts to whatever you perceive, which is why this is very, very important. Because if you're going to perceive danger, okay, oh my goodness, this headache, it must mean I have a brain tumor. Let me go search WebMD. Oh my goodness, this is what WebMD says. I must have a brain tumor. Let me call my doctors and get an appointment in. Does this sound familiar to some of you? I see some smiles out there. Okay? So if you're going to perceive danger, your body will simply respond with fight or flight alarm. Okay? Now, if you were truly running or fighting a saber-tooth, how long do you think your body can go before you habituate, before you run out of energy and you have to recharge? How long do you think? 60 to 90 minutes. Okay, that's the average time. For some people, that might seem like, oh, that's not a lot of time. For other people, that might seem like a lifetime. Okay? However, 60 to 90 minutes is about average of how much your body can handle at maximum energy output. maximum energy output, okay? So again, you get to decide. Do you want to experience the saber tooth, or do you want to experience the kitty cat? That choice is yours. So if you were experiencing the fight or flight response, you have to be able to distinguish between your objective sensations and your physiological sensations. Okay, so what is the difference? Well, objectively, you're feeling your heart palpitating, your heavy breathing, headaches, nausea, okay, sweatiness, tingly limbs. However, you get to decide what that means. And that's the subjective part. So let me give it to you in a different metaphor. Let's say you're going skydiving and you bring a friend with you reluctantly, comes with you, okay? And you're both about to jump out of the plane. And you're thinking, oh my goodness, isn't this fun? I mean, I can't wait to jump out of this plane. And you're feeling your heart palpitating, your tingly limbs, you might be a little sweaty, and you're breathing heavily, and you're just excited to jump out of this plane. And your friend next to you is looking at you like you're crazy. I don't want to jump out of this plane, this is ridiculous. And that person is experiencing the same objective sensations. Their heart is palpitating, their limbs are tingly, they're shaking. However, the person next to me, my friend, who might not be my friend anymore, is thinking, we're going to die, we're going to die, we're going to die, we're going to die. Now, we're both experiencing the same things, objectively. Subjectively, we're experiencing completely different experiences, right? So, how are we going to fight this? Because what I just described is what a person experiences during an OCD trigger. Again, you cannot control your thoughts. You cannot control your emotions. What you do have control over are your behaviors. So what we're going to target is those behaviors. And remember the fight or flight response? Well, the blue line is basically what you would be experiencing every day if you were to engage in compulsions, okay? Let me see if this works. No, it's too far. If you experience an obsession, a fear, where is your discomfort level? 0? No, it's at a 10, right? And then you engage in a compulsion, a safety behavior, avoidance, escape, and then what happens to your discomfort level? Goes down. Does that mean it's over? No more yellow dog, no more headaches. No, the obsession will always come back. So, as soon as it comes back, your discomfort goes right back up. And because you don't like to experience discomfort, what do? You engage in a compulsion and your discomfort goes down. And you're basically going up and down, up and down, up and down, wrecking your body havoc. So if you're tired and you're fatigued and you're exhausted, well, no wonder. This is what you're doing to your body. However, in treatment, specifically exposure and response prevention therapy, what you're doing is you're purposely triggering that yellow duck. Right? I don't want you to not think of the yellow duck. We're purposely triggering that headache. We're purposely triggering whatever it is that you fear, whatever it is that you want to avoid, whatever it is that you want to escape from, so that you're going to experience the discomfort. And are we going to engage in the compulsion, the safety behavior? No, because that is what you can control. That is the only thing what you can control. Okay? And if we don't engage in the compulsion, how long does it take for your discomfort to come back down? 60 to 90 minutes. So you would have to experience 60 to 90 minutes of discomfort. Okay?
Can I add something?
Sure.
Is this working? You can all hear me?
Yeah.
All right. Adding on what Dr. Yip was saying about how like viewing situations objectively for what they really are and not how they make you feel, I think that sometimes for people with OCD, sometimes people with OCD, certain situations for the people around them may seem harmless, but people with OCD, even if they can view it in an objective way and try to see that it's a harmless situation, I think people with OCD often can't logically view stuff and will think of situations as being life or death, even if they're really not. For some reason, just OCD brain will think of stuff as life or death. And I think in those moments, that's like where you have to take a leap of faith sometimes, because people with OCD, a doctor can tell you, or your family can always tell you that these things aren't real, you have nothing to be worried about, you have nothing to be afraid of. But for people with OCD, they don't believe that. They think, I do have something to be afraid of, like, this is real, I really have something to be afraid of. And that's where that leap of faith comes. And like an analogy I think of is like, well, here, how about this? All of you, like she did, can you all close your eyes real quick? So I want you guys to imagine, say you were on your knees and someone had a gun behind your head. Someone's pointing a gun at you. And they're telling you, I will pull this trigger and shoot you in the head if you don't go carry out this task. If you don't go wash your hands again, I'm going to shoot you. If you don't go flip this light switch 10 times, I'm going to shoot you. If you don't step on this crack, I'm going to shoot you. And if they have a gun behind your head, imagine how your body would feel. Imagine how your heart would be racing, how your stomach would be in knots, how you'd be sweating, how you'd be shaking, and then how your thoughts would be. You would be freaking out. You'd be full-blown panic attack. You have a gun behind your head. And I think for people with OCD, a lot of times it really feels like there's a gun behind your head. When everyone around you tells you there's not, but you think, no, it feels like there's a gun behind my head. And like with the leap of faith thing, those times when it feels like that, you have to be able to say, I think you have a clip full of blanks. I don't think you have a bullet. I think you're lying. I think you're bluffing. I don't believe you, but I don't know. And with OCD, you're never going to know, but that's where you take the leap of faith, and you'll realize that it really was a bunch of blanks. And then next time, call them on their bluff, and it's going to be a little easier. Still not super easy, but each time it gets a little easier. Each time, I think you have a clip full of blanks. And then you realize they really do, and they were lying. You're still scared of a gun, but each time you realize that, oh, I actually didn't get shot, you build up a little resistance to that fear. Slowly gets easier. People with OCD can't always figure this stuff out logically. You can have people around you, family, doctors, telling you that logically this is not going to hurt you, but people with OCD, that is a hard thing to believe. So that's where you got to take a leap of faith. You got to jump and hope you land in water, not cement.
And that's especially true during that OCD attack, right? During that anxious moment, because you do not have the capacity to think rationally at this point. And then that fear, that gun behind your head, feels really real. So I'm just going to finish this, and I'm going to turn the table to you guys. So in essence, when you're going through treatment, and this is the reason why you guys are asked to do the things that we asked you to do. We asked you to go through the torture chamber. You know, I always tell my patients, you're not here to have a fun time. We're not going to Disneyland. If your mind escapes to Disneyland, you're not doing what I'm asking you to do. This purple line is what you're going to be going through. We're going to purposely think of that yellow duck, purposely think of that gun behind your head, purposely think of that headache, that tumorish headache. And you're not going to engage in a compulsion, in a safety behavior, in escape. And within 60 to 90 minutes, your discomfort has to come down. Does that mean it's over? No, just like how OCD is relentless, treatment has to be relentless as well. So we're going to purposely trigger the fear again. And your discomfort will go back up, probably not as high as previous, okay? And then within 60 to 90 minutes, it will habituate again. Your discomfort level will come down again because it has to. Now, when I say full energy output, some people say, well, but Dr. Yip, I do exposures all the time and I'm feeling anxious throughout the day. Well, you're probably feeling anxious throughout the day because you're not engaging in the exposures fully. You're escaping somehow. You're either escaping mentally, or you might physically not be at Disneyland and your brain is at Disneyland. So when I say full immersion, I mean all 5 of your senses has to be immersed into the exposures. Okay? Full throttle. So it's kind of like, do you want to be the long distance runner or do you want to be the sprinter? The sprinter has a very short distance to go and therefore must use maximum energy output. However, the long distance runner has a very long distance and must use moderate energy output. You want to be the sprinter so that your body can habituate quicker. Okay? So essentially, this is what's happening. We're exposing you to the obsessions because, again, you have no control over the obsessions. You have control over how you respond and react to the obsessions. Okay? And then we're asking you to not engage in the compulsive behaviors. That's the response prevention part. All right? So now that you understand why you must do what we're asking you to do, which is exposing yourself to the fear, what do you think the goal is? If you have a fear of relapsing, what do you think the goal is? What do you have to expose yourself to? Relapsing. Exactly. You have to expose yourself to having OCD, and that's the paradox here. Right? You don't want to have OCD. However, the more you don't want to have OCD, the more you're going to have OCD. Because don't think of the yellow duck, you're going to think of the yellow duck. So you have to be okay with relapse. You have to be okay with having OCD. Because again, there's no cure for OCD, right? It's a lifestyle change. It's a change in your attitude. It's a change in your thinking process. It's a change in your behavior. And as long as you can maintain that change, then you might just be okay. However, once in a while, we all slip up. I mean, how many of us have been on a diet? Oh, I'm off the wagon. How many of us have gone to the gym? January 1st, actually January 2nd, everyone goes to the gym. By February 1st, half of those people have fallen off the wagon already, right? So you have to be okay with falling off the wagon. So these folks here are going to tell you how they got to be okay with falling off the wagon. So here's your PowerPoint.
I've got my glasses
So
on.
the first thing, okay, so I'm going to read this and then you guys talk about your experience.
All right.
Okay, so the first strategy is mindful tolerance via the rope-a-dope, so embracing OCD to defeat it. What does that mean to you, embracing OCD to defeat it?
So for me, one of the things that, like, whenever I had negative thoughts during therapy, one of the things that they just taught me was like, okay, so that's gonna happen. If I'm gonna get sick because I didn't wash my hands 20 times, then you just have to embrace that and embrace OCD. Like, okay, I'm gonna be sick. I'm like, whatever I do, I'm gonna be sick. Yeah, just that versus washing your hands. Like, oh, if I have this bad thought, it means I'm gonna be a mass murderer one day. Yep, that's what I am. I'm that bad person. So that was my experience, just like embracing that, because I don't know, deep down in your bones, I know I'm not gonna end up being a mass murderer someday, but to sort of embrace that uncertainty of not being sure if I'm really a good or bad person, that helps a lot with like ERP and helping the compulsions tone down.
And I say that, that's how OCD thrives, right? OCD thrives on doubt and uncertainty, right? So even though you might deep down in your soul inherently know that you're not a mass murderer, well, what if? What if you are? What if you did something and you didn't even know that you did it? And that made you a mass murderer, right? So again, OCD thrives on doubt. And what we want as a society is certainty, right? We want absolute certainty. However, according to Benjamin Franklin, the only certainty in life, folks, is what? Death and taxes. That's it. That's all you got. So, Sam, you might be a mass murderer.
Maybe. We'll see.
If not today, maybe on another day, right? You never know.
Well, for me about this, I think, like they're saying, deep down with OCD, you may, in your soul, you may know that you're not a mass murderer, but I think that people with OCD often, kind of think they know, but they doubt it so much that it's almost too strong, and they feel like, well, like they're saying, deep down, they don't think they're a murderer, but people with OCD, you really don't know. And that's the hardest part about it. You have, like I said, family, doctors, all that, saying, no, you're not a mass murderer. And you may have that gut feeling, I know this, but sometimes the OCD is so strong that you really almost feel like you don't know. Like, it's not deep down, okay, I know I'm not a mass murderer, so I can easily do these exposures. It's not that easy. Deep down, you may think, what if I really may be a mass murderer? And that can hurt people from doing exposures, because it's hard to listen to that little voice inside you saying, no, you're not, because the OCD overpowers that for a lot of us. And you may really, with your bones, believe that my rituals saved me from my fears. You may really believe that. And that's where I go back to the leap of faith thing, because I think the first couple of times you start doing your exposures and you start resisting, I think that you really may think that if I don't give in to my OCD, my fears will come true. That's why it's difficult, because you really think that your fears are real. Yeah, they might not be, but they might be, and that's why it's so difficult. So like I said, for the first couple times doing your exposures and resisting, hardest thing in the world, because you think this stuff might be real. But that's where a leap of faith happens. That's where you gotta say, I don't know. I accept that I have a mental illness. I have doctors and people around me who are not diagnosed with OCD. I cannot trust myself. You have to be okay with realizing that I'm sick and my brain may be lying to me. I don't know for certain. I'm gonna take a leap of faith, and you will come out the other side okay. And then the next time you have to do a leap of faith, it's a little easier, because you realized maybe it is lying, maybe my OCD's lying. But the first couple of times, golden truth, and you think that's 100% real, but when you build up that tolerance to it, it gets a little easier, and then you get to a point where you can have an OCD thought and you think, no, that's bullshit, that's a lie, I know that, but it takes time to get there. That's why you gotta take a leap of faith a couple times. That's the only way to get there. But like I said, first time, you start exposures, first time, you really don't know what's gonna happen. But you got to realize that if you have been diagnosed with OCD, you really can't trust yourself a lot of the time. And you got to be okay with that. Take a leap of faith and realize, I trust these doctors more than I trust my OCD.
So just to give the audience a little bit more background, how long did it take you guys to fully be able to embrace having OCD? Because I'm here sitting, and I know what you guys went through. They don't know what you guys have gone through, right? And if I'm to hear what they're hearing, is that, oh, this was just easy peasy for you guys. Just embrace it, y'all. That's it. Goodbye. Right? So at what point in treatment, how many times How much doubt did you have before you were able to just embrace?
Well, I did Dr. Yip's 8 week, was it? 8 week? 7 week.
6 weeks?
6 week intensive outpatient program. By the second week, I was like, nah, I'm gonna fly home. I don't want to do this anymore.
No, she didn't just say that. She darted
well,
out.
I said it more aggressively, actually.
See, they make it sound like it's so easy, you know?
No, but I was very adamant. I was like, I can't do this. I can't do the treatment. I'm out. I think I'm good with living with compulsions for the rest of my life. I just can't do the exposures anymore. And she came to my house and she was like, okay, if you're not coming to the office, we're coming to your house. And she actually did that. And I think it was about the third or fourth week where I finally started to embrace the treatment and embrace that this is what I was going to have to deal with if I wanted to get better. And I think a lot of it stemmed from them reminding me what else I had to live for and what else there was past, the struggle of being in treatment and what the other end of that would be. So I think that was really important.
But even before IOP, you went to treatment before,
Yeah.
right?
And I would just be like, oh, okay, I'll do like what you said before, I'll just do a minimal output.
Right.
I wouldn't really
You were the
invest-
long distance runner.
Yes, I was. I'd go and I'd be like, oh, I did 2 exposures today out of 5. I'm good for the month. And then and that wasn't helping, clearly. That wouldn't be helping at all. But when I finally was like, okay, this is it. This has to be my main focus. Like, I took a leave of absence from school and I was like, getting better has to be my number 1 priority. That's when I think things started to really turn around.
Well, for me, there was many years after starting therapy before I made any progress. I was in hospital after hospital, program after program, certain hospitals where they have security and you can't even say, I don't think I want to do this, I want to go home. Like, no, you're stuck there. And if you try to leave, police come and get you, like, place after place. Just, so much time spent in the programs, hospitals, everything. No life, no quality of life, none of that. And I think where the turnaround point was for me was I had somehow at the end of high school, ended up graduating, even though I'd missed so much school due to the OCD. And I wrote about my OCD in my college application paper, and I got accepted into the University of Oregon. But my OCD was still terrible. There was no way I was going to be able to succeed in college at all, let alone enjoy it. I couldn't enjoy anything. And I think the turning point for me was really just a lot of soul searching and realizing if I don't start working on my stuff, if I don't fully commit to this stuff, my life's going to fall apart. I'm not going to be able to go to school. I'm not going to get a job. I'm not going to do anything that I've dreamed about my whole life. I'm not going to have a family, not have kids, not be successful, nothing, not make good memories. I realized that there's been so many years of my life that the OCD took. If I let it keep taking stuff, if I let it keep ruining my life, then I'll end up 50 years old still struggling and saying, we had talked about this earlier, but end up 50 years old saying, I wish I fought my OCD back when I was 17, 18, 16. I didn't want to end up 50, 60 years old regretting my whole life saying, dang, when I was with Dr. Yip or when I was at this place, I should have given it my all. And I knew that if I didn't fight this now, if I didn't learn to get better, then my life would be taken away from me pretty much. I got one life and I refused to let myself end up in my deathbed at 60, 70 years old saying, I wasted my whole life on OCD. When I had a chance, when I was young too, I had a chance when I was young to really go in, fight it, resist it, learn to go with the ERP process, learn to get better. And I realized that, like I said, I have one life. Am I gonna take my power back? Am I gonna beat my bully? Am I gonna learn to defeat this terrible OCD? Or Or am I gonna let OCD ruin my one life, my one chance? And that I think a lot of just thinking about that, thinking about if I don't get to this, like, yeah, stuff's just gonna be ruined. Like, that really motivated me to really get to working on it. And like I said, I had doctors, I had family helping me, I had friends helping me, I had hospitals trying to help me for years, and that made some progress, but not a lot. It really came down to me personally saying, I'm not gonna do this stuff anymore. And like, it's like in AA, Alcoholics Anonymous, or in any Narcotics Anonymous, those programs, it's all about you're not gonna get better until you decide to get better. You could have 100 of the best of the best of the best doctors in the world telling you what to do, but if you don't wanna get better, you're not gonna get better. And you've gotta get to a point where you're so fed up, where you're so tired of the OCD, where you're so ready to live a normal life that you make the choice, because nobody can do it for you. And I think that when I made the choice, when I decided I want to get better, I'm the only person who has control of this. That's when I started getting better, because there were literally years where I would talk to my parents and I would say just like, please make it go away, please help, please make this go away, this is torture. But that doesn't do anything. It got to the point where, like I said, I had to decide. And when I decided I'm gonna get better, that's when I started to get better. Still hardest thing I've ever done in my entire life to get better. But it only worked when I wanted it to work.
You know, to talk about, just to piggyback on the idea of torture, right? I have so many of my psychodynamic colleagues who would say ERP is torture. How dare you? Even though ERP is the evidence-based treatment, right? And again, you have to think of it this way. You can either go through your torture short-term to gain long-lasting relief, or you can be tortured your whole life. Either way, you're going to be tortured, right? So take the path of least resistance, which is the lesser evil, okay? And again, you have to make that choice.
And I also think that like a lot of us in here who have OCD and are in therapy, we do our exposures in therapy, we do the work in therapy, and we may be doing good exposures that are difficult, but for some reason still not getting better and still not getting the freedom that we want. Like I bet a lot of us have been doing exposures for a while now, seeing a therapist multiple times a week, all that, and following the steps, but for some reason still not getting better. And the reason behind that, I think, is that doing your exposures and doing your fighting and your work in therapy is one thing, but I think when it really counts is when the times when you're like all alone, the times when it's just you and your thoughts, no therapist around, no set up exposures, it's just you and your OCD. Those are the times when you fight it, when you resist it, when you do your own exposures. Those are the times that really help, and those are what count to getting better. Because you could do 100 exposures a day in a doctor's office, and yeah, you might get a little better, but it doesn't even count if when you go back home you mess it all up and give in to a bunch of rituals. And it doesn't even count if you go home. Like if you were doing contamination stuff in therapy and you did a bunch of touching dumpsters, dirt, nasty stuff, touching bird poop, whatever it is, you can do a bunch of that in therapy and it'd be hard. And you may do good at it, but if you go home and you're all alone and you want to spend 45 minutes washing your hands, then it was pointless. It's about when you're alone, no one's there. That's when you got to do the fighting. That's when you got to resist it. And that's how you get better.
Okay, we're going to move on to the next strategy, which is taking a seat, sitting with your fight or flight discomfort through narratives and loop tapes. So, can you help the audience understand what that means?
Okay, so narratives are basically you writing a story of your worst, whatever trigger you had in the moment. Say it's, I don't know, like...
The mass murder.
Oh yeah, the mass murder. So you have to take it to the extreme and your worst possible fear, like what the consequences is going to be like, or what the consequences are going to be like. I didn't check if I ran over a person with my car, and if I don't check, I'm going to be a mass murderer, and going on and on and on off of that thought, and what the end worst consequence is, and to have a story around that, beginning, middle, and end, and just reading it over and over again, and then recording it on a loop tape, and then listening to it again and again and again until you habituate to that idea that the worst consequence, like being behind bars and dying all alone because I'm a mass murderer and my name being living in infamy, and to habituate to that idea and to sort of settle yourself with that idea. For me, that's one of the techniques that really helped, especially when I felt like relapsing or my mind felt like relapsing. It was really the loop tapes and the narratives that really helped me get settled back and stop me from compulsing for the most part.
And I think loop tapes and narratives are useful for those exposures that we can't really do in vivo. I mean, in vivo exposures, which are real life experiential exposures, are the most effective. However, I mean, I can't make you be a mass murderer. I can't say, okay, we're going to go and kill a few people now, right? And I can't say, okay, we're going to make this plane crash now. I can't say, let's go and push your grandmother down the stairs, right? So for those situations where it would be unethical or illegal to engage in, then we do narratives and we loop it on a tape. And again, when we're doing this, the goal is not for your head to be at Disneyland. The goal is for you to be really imagining this story coming true, okay? And then experiencing the discomfort from that. So even when you have a fear of relapsing, just because you have that fear of relapsing doesn't necessarily mean that you have relapsed. So we have to go back and do the narratives of, well, what it's like if you do relapse, and what are the consequences if you do relapse. So go ahead, Harold. Or did you have something to add?
Well, I mean, I think everyone's treatment is different. I think everyone's therapy is different. And for me personally, the narratives and the
Loop tapes.
And the loop tapes, like, I mean, I definitely see the value in it, but personally, that just wasn't what did it for me. I know it works well for some people. But yeah, everyone's treatment's different. So I'm a pass on that one.
Okay. All right, so then the next strategy, and I just want to say that these strategies, even though these were strategies that I've assigned to them, they were the ones who said they want to speak up on this, even though this was many months ago, so I hope you guys still remember.
Yeah.
So the next one I have here is delay, waiting it out. So I'm not sure who came up with this one.
Well, this right here, delaying, I would say that's one of my top most useful things for my OCD, that what worked for me. So like, say something triggered my OCD, I have a bunch of anxiety and I'm just itching to go ritualize. Whatever ritual that may be, I'm being pushed and pulled to go ritualize, and every bone in my body and all that anxiety, it just wants me to go ritualize. And in that moment, what I've learned that can really help is like, when all you're thinking about is ritualizing, when that's the only thing on your mind, if you can wait, you might even tell yourself, I can give into this. I can ritualize, but I'm not going to do it right now. I'm going to wait.
Harold, can you apply this to your fear of relapsing to OCD? What was it that you had to wait out? What was it that you were delaying? What was the ritual?
I'm not really sure. Well, here, let me finish this thought and I'll try to think of it. Well, I think like on that, like what I'm saying is like, you may be telling yourself, I'm going to be able to ritualize later, but I'm not going to do it right now. I'm going to wait 30 minutes before I do it. I'm going to wait an hour. I'm going to wait 2 hours. I can give into this ritual, but not today. I can give in tomorrow. Tomorrow comes around. I can give in, I'm gonna give in the next day, not today, just for today, I'm not gonna give in, I'm gonna wait. And I think that when you delay, when you wait it out, two things can happen. One is that the anxiety really does dissipate. It goes away because you waited, and then you realize, oh, I actually don't even think I need to give in at all. And that's best case scenario, and that can happen a lot. If you're waiting a couple days, however long until it takes, if you wait long enough with your rituals, you will eventually not feel the need to do it anymore. And like, it can take a long time. There was one ritual for me that I wanted to do so bad, and I thought about it every single day for 5 months. One ritual, but every day I said, no, I'm gonna keep waiting. It's gonna go away. I'm gonna keep waiting for 5 months. That's a term and a half of college. Like, that's a long time. And it wasn't going away, but I knew if I keep waiting, it eventually, I won't care. And then 5 months in, eventually, I don't think I need to do this anymore. But like I said, that's best case scenario. Wait it out and you don't care anymore. A lot of times what may happen is you do wait it out for a while, but you do end up giving in, because I mean, sometimes people with OCD end up giving in, and that's what happens with people with OCD sometimes. But if you can wait it out, even just wait for a while before you do give in, then it doesn't reinforce the OCD nearly as much. Because like when you have all those sirens and that panic attack feeling and the fight or flight, and you give in right away, that just reinforces it every time that there is a real threat. But if you wait a while until you're relaxed and wait until you're relaxed and feeling better, if you do end up giving in, it doesn't reinforce the OCD as much. And resisting fully would be better, but if all you can do is just wait, that's still better than nothing, and next time it will be a little easier. So yeah, anytime you guys are really struggling with something, just tell yourself, I may end up giving into this, but I'm not gonna give in right now. I'll see how I feel later. Give yourself some time, watch the anxiety go down, and then make the decision where you can think more logically. Because when you're in fight or flight, like they said, you cannot think straight. So don't try to make decisions when you're in fight or flight. Wait a while, wait till you calm down, wait till you can think, and then make a decision. And more times than not, you'll probably make the right decision and think, oh, I'm relaxed now, I can think logically. That ritual sounds stupid. Gotta delay, I'm telling you that, for me and for some other people with OCD, I know that is one of the most useful things. And that's been a huge key for my success, I think. Definitely.
So I want to make sure we get through all of this, and
Okay.
we only have 25
Yeah.
minutes left, and
All
we
right.
still need to go through Q&A. So
right.
Sam?
Actually, I was gonna say that waiting out was actually one of the ones that worked least on me, and it was more of doing it wrong.
So doing it wrong. So deny doing it wrong.
Doing it wrong. So like I imagine me being OCD's very rebellious child, so OCD would be like my parent telling me what to do and me saying, fine, I might do it, but I'm gonna do it my own way, and it's gonna be messy, and it's gonna be my own spin on it. So like, for example, one of my later rituals would be rereading pages. Like whenever I would read a book and it wouldn't feel right, so I would have to go back and read a page. Doing it wrong would be me reading the page backward, or reading the last paragraph first and then the first paragraph and then the third paragraph, and just doing things out of order, or doing things to a bad number. If I felt like I had to have a mental compulsion, I would do it to a bad number just so it would be contaminated. So I think doing it wrong helps a lot when you're sort of not mentally strong enough to say no to the compulsion, but it's your own way of telling OCD, like, okay, I might give in, but I'm also doing it on my own terms, and I'm not playing by your rules.
Take your power back a little bit when you do that.
Yeah.
Might not be a lot, but that and delaying, even if you do end up giving in still, then like at least you did it your way, at least you took some of your power back, and slowly but surely, that's you gaining strength, and that's wearing the OCD down. Because if you give it all attention, if you give OCD all the power, if you do everything it says, the only thing that will happen is it'll get worse. Even if you end up giving in, if you wait it out, do it differently, whatever you do, take a little bit of your power back, even if it's not a lot, just a little bit. Even if you want to wash your hands for 5 minutes, okay, we'll wash it for 3 minutes, and that's still a long time, but 3 minutes is better than 5, and that's getting you power, that's getting your power back.
Okay. So next one is keep it moving, shifting attention and energy to a focused task. Keep it moving. I know you guys have heard me say that many a times.
Yeah.
Well, I mean, I think with this, sometimes the OCD is you're so caught up with OCD, you're so caught up with worry, and it just wants you to be at a standstill, just crouch into a little ball and just worry. Like whatever it is, it just wants you to be stuck and in a standstill just worrying. But I think one useful thing is, even if you're worrying, even if you're in fight or flight, focus your attention on the next task, even if it's just as simple as, I know I feel like this, let me just get up and brush my teeth. Let me go downstairs and make a piece of toast. I can worry, but let me just do something. Let me keep going. First thing, brush my teeth. I'm still worrying, I'm still freaked out. Okay, let me get dressed. After that, I have to go to work, I have to go, whatever your daily duties are. Keep it moving, even if you're feeling terrible. Don't think about what's going to happen later. Don't think about what's going to happen tomorrow. What is the next task that I have to do in my day? It's okay to worry, but what's the next thing I got to do? Go do that. And then what's the next one? Go do that. And you'll end up getting kind of distracted and getting sucked out of your head, and it'll get a little easier, and it pulls you out of your head a little bit.
One image that I like thinking about when it's keep it moving is, do you guys know like the wind up soldiers that just, you wind them up and then they go one foot after the other? So that's the image I like to keep in mind, like that I'm that little soldier and I have to keep it moving.
One foot in front of the other. So in terms of applying this, when you guys were worrying about relapsing, what was it that you were able to do to keep it moving? I mean, what else were you able to focus on?
I think it helped a lot to have like a goals list. I know after I finished the program, we had to set up a goals list of what I planned to do, how to reassimilate into life, whether I wanted to go back to school or get a job, and to have those be the focus of my daily activities. I couldn't stop. I couldn't spend 3 hours in the morning worrying or doing mental rituals when I had to go on job interviews. So to have a list of goals, yearly goals or monthly goals, just to have an activity to look forward to at the end of each day or at the end of each week really helped.
And I would say that for the both of you, would you say that mental rituals were predominant during this period in your OCD recovery?
Oh, for me, for sure. It was like during IOP, what happened first was all the physical compulsions came out, and once we tackled those, that's when all the mental compulsions started cropping up. It was almost like OCD didn't want to admit defeat, so they were like, we're going to throw one last thing at you. So, for me, it was a big part, and yeah.
Harold?
I mean, I agree with that. I think physical compulsions, that's only scratching the surface. Real OCD is what's going on inside your head, and I think, the physical stuff, you're just getting started. I mean, for anyone who's been doing this for a while, often I feel like it shifts to just playing with your thoughts. It's just in your head, and a doctor can't see in your head. People around you can't see in your head, so that's when you gotta follow the steps. That's when you have to do what people are telling you to do to get healthier, because now it's all you. It's in your head. You could, I mean, I'm sure, like, I may be wrong, but this is a room full of people with OCD. I guarantee someone in here is sitting in here worried, ritualizing in their head, thinking, thought loops, whatever it is. I guarantee someone, maybe multiple people, struggling right now. And that's what real OCD is. It's in your head. It's not always going to be physical. So yeah, that's just keep following the steps. It'll get easier.
Okay, so the next step, the art of not knowing. So this is really, really important, right? Accepting uncertainty and confusion. Nobody wants to be confused. However, we encourage confusion in our program.
So for me, it was just accepting that I didn't know anything and that I wasn't ever going to be sure. And I think for me, especially now when I'm in the recovery portion of the treatment, I try to be uncertain about as many things as possible. So like before, if I would watch TV shows, I think just the small things, I would watch them out of order. What happened in the episode before? I don't know. When I read a book, am I sure that that's where I left the bookmark at? I don't know. I'm not gonna check. And I think it's habituating to even those little tasks that may not be, an OCD compulsion or an OCD fear, but to be uncertain about the little things helps you also be uncertain about the OCD fears. And I think it's something that hopefully I don't know. Well, I'm uncertain if it's gonna keep me from relapsing, but it's good practice. It's good practice.
So are you going to relapse?
I don't know.
Perhaps.
Maybe.
Yeah. Harold.
I think, like she said, we don't have a lot of time left, so let me try to, can I
Sure.
put these two together kind of, because they
ignore
both
versus resisting.
Well,
taking the path of least resistance.
with both of those. So like it says up there, the art of not knowing, I think, like we were talking about confusion, I think OCD can be super confusing, and it can just really play with you, and you'll just be so uncertain, just be so confused, especially when you're resisting, and when you're doing your ERP, it can be very confusing. And I think one of the best things you can do when you are confused is ignore that feeling and not try to figure it out, not try to find the answer. We always called it, don't try to be the philosopher, don't try to figure these confusing things out, because OCD is not logical. You can't logically figure it out. It's gonna be confusing, and you have to be okay with it being confusing and let that feeling go away on its own, because you can't figure it out. The more you try to figure it out, the deeper and darker it'll get. Thinking about the OCD worries is OCD in itself, and the more you give it attention, the worse it gets. So that's when ignore that confusion, let it be there, and be okay with it without trying to figure out. And just like anxiety, that confusion dissipates. Give it some time, give your brain some time, maybe days, maybe weeks, maybe months. But eventually, your head does clear up a little bit. You find the logic in the situation, and you realize, oh, I don't need to do these things. And then, of course, since you have OCD, another thing will pop up right after, and then another and another and another. That'll always happen. But when you get better at ignoring those feelings, just waiting and just accepting how I feel, it definitely gets easier.
And that's not an easy task to do. I know there was so many times where Harold would call me and leave messages telling me how confused he is, and he just wants answers. And my response to him is, you're supposed to be confused. This is a good place to be. I want you to be confused. We're going to practice exposing to being confused. Now let's see how long you can delay this.
And they also were talking about, Dr. Yip asked, do you ever think you'll relapse? And I think that the most logical answer to that is, I think anyone with OCD will have multiple relapses throughout their entire life. I think I'll relapse many times. I think every couple of weeks I have small relapses, but I think the goal for any OCD sufferer is to realize relapse happen. The goal is not to never relapse. The goal is that each time you do relapse, it's less severe and it happens less frequent. There will always be the hard times. There will always be a hard week and then some good weeks, hard day and then some good days. There's always going to be stuff, but the goal is not to never relapse. That's impossible. You have OCD. It's going to come up sometimes, but every time it comes up and it's very difficult, and you have a mini relapse, you want it to be less severe and less frequent. And the more you work at it and the more you follow the steps and fight it each relapse, next time it'll be a little easier, next time it'll be a little shorter. Then eventually you get to the point, like nowadays, after doing this for quite a long time, my bad OCD day would be like the most wonderful, perfect OCD-free day back when I was struggling my most. Like my worst now would have been my best back then. And that's every time a little easier, a little shorter, a little less torturous. Yeah.
So I want to help everyone understand the difference between ignoring and resisting. Because when you start out treatment, you're asked to resist your compulsions, right? However, once you get to a point where you've gone through ERP and now it's becoming mental compulsions, there is no resisting mental compulsions, right? Because if you resist, they persist. Don't think of the yellow duck, you're going to think of it even more. So ignoring is actually the path of least resistance, because ignoring doesn't require any energy. If you're resisting something, it's energy, right? Whereas if you're ignoring, you're just going through your way, your day, and you're just ignoring. Okay? So do you want to talk about ignoring versus resisting?
I think that for me personally, and I think for a lot of people, sometimes resisting your OCD and not giving in is the hardest thing in the world, and sometimes that's can't resist. And that's the sad truth about OCD. Like, you physically can, but sometimes your just brain is locked up and you cannot get yourself to resist it. It is just too hard. And I think that's where the ignoring comes into play. You're not saying I'm gonna resist, because sometimes that's too difficult. You're saying, I don't know if I'm gonna resist or give in, and that's okay. Let me keep moving, let me do my next task. I might end up giving in. That's okay. I might end up resisting, that's okay too. I don't know right now. I'm gonna ignore that decision, and I'm just gonna keep moving. And then, yeah, eventually when that anxiety goes down, when you feel a little better, then you can decide, okay, I'm not gonna do that. But when the anxiety's high, when you have fight or flight, sometimes you can't say, no, OCD, I'm not gonna do this. Sometimes that's too hard. So you have to be okay with, I might give in, I might not. That's okay. What's the next thing I gotta do? I'll figure it out later.
Sam?
One of the things I like keeping in mind is being blind and deaf to OCD. And so just not that you're not pretending it's there, but not letting it affect you, or like Harold said, not letting it affect your daily activities. So another picture I like keeping in mind are like, do you guys know the horses with the blinders? So that's what I like to imagine myself at. So I'm just like straight ahead, what's my next goal? If OCD comes, I can't see it because I've got the blinders on because I'm focused on my next task. So yeah, being blind and deaf to OCD.
That's a great analogy. Other thoughts that you guys want to add before we open it up for Q&A? And we only have, I think, 6 minutes left.
I mean, I think the biggest thing for anyone with OCD is that realizing that, like, it's not gonna be easy and it's not supposed to be easy. Like this, I mean, a lot of you probably had OCD for a while, been struggling with it for a while. It's not a quick fix. I think when I first started therapy, I wanted a quick fix. Let me go to this place. Hopefully I can go to IOCDF and they'll have the answer. They'll have the, whatever it is. Your people are looking for a quick fix, but in reality, it's never a quick fix. This is a lifelong battle, and you gotta be committed to that, because that's the only way you'll get better. You gotta be in it for the long haul. But I honestly don't think it has to be something that is difficult your entire life. Like we said, put in a couple years of commitment and hard work, and then you have a life of freedom. 24 hours of my day besides sleep was spent in like panic attack mode, pure worry, nothing else. Nowadays, I would say 2% of my day is spent worrying. That couple years of hard work, I'm telling you, anyone, couple years of hard work, you can get your life back.
Any other?